is received for Dr. Ovidiu Penesh, a medical sciences doctor. We express our gratitude for his attention to each of our notes sent from you. Right now, I'm engaged with a matter that strikes me as exceptionally important and complex to identify because we usually disregard skin issues when they manifest. We tend to apply a bit of ointment or cream, thinking it will resolve itself. In truth, this can actually indicate deep distress within the organism.
Sometimes, systemic diseases affecting the entire body give the first signals at the skin level. For the ones that are not visible, you cannot make the connection that they might be related to skin diseases. However, if these warning signs emerge on the skin, it is important to learn how to identify them so we know how to respond. What do these signs resemble, and what could they potentially conceal? Many individuals express concerns about spots on their skin, dark brown spots appearing on the skin. Dark brown spots that are increasingly frequent can sometimes merge, becoming so numerous that they form a larger patch. These spots can occasionally signal an issue with the adrenal glands. The adrenal gland, situated above the kidneys, plays a crucial role in secreting specific hormones. In cases of adrenal insufficiency, we begin to face problems associated with muscle pain and weakness. When we test our blood sugar, we often find it to be low. Occasionally, these patients frequently exhibit very low blood pressure with consistently low measurements, and this sign is evident here. It is essential to consult our family physician and an endocrinologist right away to assess our hormone levels and implement necessary actions.
This is thought to signal liver disease.
Yes, it is considered liver disease because there is a whole range of purpura that appear due to liver issues. Why is the skin changing color? Because when we tan in the sun, for example, our skin darkens at the cellular level. Melanin, which is dark, gathers around the nucleus of the skin cells. Under ultraviolet radiation from the sun, when it acts on the skin, we adapt and the skin darkens as these granules spread throughout the cell's cytoplasm in the entire cell. Thus, if there are problems with this hormone, these cell areas start to hyperpigment. Other times...
One more question. I heard that GFK, among other things, had Addison's disease, and you can observe Addison's syndrome through the jaw, ultimately a specific fact. The hair never loses its color and remains tanned all the time like this.
In general or in patches, and you darken the patient further, but before reaching that stage, the first signs are like this: pigmentation, larger spots, they tend to merge. But you begin to question and go for tests if these show up like this. There are also what are called age spots, but these are primarily due to significant stress that puts a lot of strain on this gland, which must work, and at some point this apoplexy appears. It can no longer able to produce enough hormone, and all these things occur. The patient is weak, has low blood pressure, is tired, and experiences constant muscle pain. Many say that with age, my muscles and bones started to hurt. At times, you may experience hypopigmentation, which refers to depigmentation. It's similar to vitiligo. You observe it, and indeed, it might be vitiligo. What does this imply? There are areas of autoimmunity like this. Sometimes it can stem from a simple food intolerance and even allergies. Your immune system begins to produce antibodies battling against your own body. In this instance, it targets the skin areas. Autoimmune disease. You can also have patches, sure, with more organized areas, just the elbows or just the backs of the knees at the base of the hair. Is it treatable? It is an autoimmune disease. You need to stop the trigger, identify what happened at the initial moment, what caused this disease. Certainly there are specific therapies, but overall it's always a balance between immunity and treatment. To soothe the immune response, any trigger can start to activate again. You consume the food that led to this, then your body starts to fight against the glands as well. Other glands like the thyroid can lead to autoimmune thyroiditis. Typically these patients have several areas affected, multiple conditions in different regions. Sign, yes?
sign.
Yes, indeed. Indeed. Certain dermatological issues can cause depigmentation, yet they possess a distinct character and look. It's important for those who find themselves in your mind in this situation and have certain areas that appear in invisible zones to others. You should go for a checkup. It's very important to do so because addressing the issue early prevents it from worsening and makes treatment easier. In other words, it can be treated and calmed more easily when addressed at an earlier stage. Many of you face situations where skin breakouts happen on the skin, be it in intimate regions or areas that make you feel self-conscious.
Something that caught me off guard.
It may show up all over, like on the chest after eating, related to food infections, right? There are pathogens present, the food is contaminated, or you consume food you're allergic to for the first time, which can trigger immune responses in your entire body, which will cause these eruptions. Occasionally, you could have issues like varicose veins or infectious diseases that progress with eruptions. It's very good, especially if we see it associated with itching, with bad states, fever, and a general feeling of malaise. We must promptly visit a physician to obtain an accurate diagnosis and not overlook these skin rashes. Skin, it can mask serious infections. It may conceal autoimmune syndromes that can develop and exacerbate the general state of health. Thus, particularly if it continues, especially if the area expands, especially if it worsens from one day to the next instead of calming down, and if you don't link it to a specific food, then it's a very serious reason to seek medical attention. An allergy. You can have an allergic reaction that progresses with erythema, with redness of the body, the tongue may swell, you may have trouble breathing, you are already experiencing this. You went to the doctor urgently because it's clear that it's no longer a matter of
Something that presents such edema. The first thing you think of is poor kidney function. Yes.
expected. However, it could be heart-related or something else, but with these generalized ETMs or swollen hands, many can't wear their rings anymore. Yes, I ate salty food. My shoes, especially the heeled ones, don't fit anymore. To which other manifestations can be associated, like you don't really like the cold, you're tired all the time. A general feeling of exhaustion and depression, where you lack the motivation to do anything, preferring inaction over action. And so on, with ETM persistence, dry skin but swollen even though it seems to have water underneath, and so on, affecting the whole body. And the face that puffs up and is like that most of the time doesn't change in the morning or evening. You look at this and realize that maybe our thyroid, that gland, isn't functioning normally. If it doesn't produce enough thyroid hormone, metabolism drops, causing these accumulations under the skin. The skin is both dry and of poor quality. We'll immediately go to get our thyroid tests. We'll see the endocrinologist, who will prescribe hormonal replacement, and everything will be resolved. But we must pay attention that if we have ETM on the skin, we don't just sit and ignore it. It's a very serious pathology.
Beneath the moles that most people have, generally, various papillomas, all kinds of growths, can dangers be hidden again?
Many people have obsessions which can be beneficial at times, but they shouldn't dominate your life. A lot of people have moles that don't matter at all. Moles become significant when they exhibit certain traits, particularly if your parents have them in the family. The genetic factor is also a significant reason here. So if you generally have moles and spots on your skin in the family, it's a sign that you have inherited them too. However, if these moles begin to grow and increase in size, especially if you look at one and suddenly it starts to grow within weeks, or if more and more appear, Now, are they pale or colorful? This is very significant. It's important, especially for those with many moles, as they differ from one another. Some are less dangerous, while others, especially those with irregular bases that are flatter and spread out, are more concerning, particularly if they developed and grew from sun exposure. We promptly visit the dermatologist to get some pictures taken with a special camera. This mole map that we check year after year, and it's healthiest to know if they have evolved or not. Moreover, the dermatologist can also examine them with a special magnifying glass and certain tests. Specific lights will indicate whether the moles are concerning, and if so, a biopsy will be done under sedation. What to do in this situation, besides seeing a dermatologist as soon as possible, is to ensure we do not expose these moles to the sun. There are transition areas that will be very sensitive to solar radiation and may degenerate if the mole is problematic. Therefore, we observe, count, and check them, ensuring they are always covered. If they are exposed to the sun and the edges, we cover them with sunscreen. And we will talk more about this sunscreen because it is important.
If this acne persists,
And the blackheads,
they continue to persist and cause distress despite treatments.
everyone buys, scams, and lies a whole
That's
range
right.
of substances. They close your pores, remove blackheads, it diminishes acne. We must remember that the skin is a living tissue. This living tissue reacts to all factors in our entire system, just like any other organ and tissue. Thus, we consider that if something appears on the skin, it is due to a systemic issue. Our eating habits, the way we drink liquids like water, and whether we have enough or not. The way certain foods can cause food intolerances, allergic reactions, and skin issues like redness and acne. Certain diseases like Staphylococcus can cause acne and affect pore function, either closing or not opening them. Oxidative and nitrosative stress, meaning how detoxification mechanisms cope with all the toxins in food. Toxins from our bodies and hormonal imbalances. Many hormones, when in excess, will affect the glands at the base of hair follicles that should moisturize the skin. This overstimulation leads to swelling and increased sebum production. Thus, all these tissue imbalances are the cause of hormonal imbalances, and hormonal testing is necessary. The cause of nutritional imbalances, things that are lacking or in excess, which need to be checked and completely removed.
We move on to the flaky skin that we can see and that we keep treating with creams.
When you mention having dry, flaky skin on your palms, a lot of people experience this saying, "Oh dear, I used detergent," and it could be the cause. The component indicates that it might be contact dermatitis and can develop this way. What does that imply? It implies that these outer layers generate more and peel away from the epithelial layer. It is completely unpleasant. It is not a cause of dehydration, but usually we think it is a systemic disease like a vitamin deficiency. The lack of certain vitamins and minerals is essential for skin metabolism. We think of skin as something we are born with and keep forever. No, skin is an organ that develops over time. From one day to the next, there is a germinative layer at the base that produces new cells, and as it grows, they move outward, and in the end, there is a subtle shedding process, not so obvious, which I remove when I wash and with the towel. So we think about whether we lack them and whether we have or not, and we adjust our vitamins and minerals and certain hormonal imbalances. I have an issue with skin peeling, and I don't use a lot of creams, so I'm going to check what I might be lacking.
Individuals who are truly battling excessive perspiration might find a way to eliminate.
Am I or am I not in a high temperature environment? If you've excluded high temperatures, I've reduced the room temperature, have good humidity, and I'm not performing strenuous activities. While sitting at my desk, I realize I'm experiencing constant excessive sweating, and since I'm not exerting myself much, I suspect I have some problems. Hormonal issues in general. The hormones in our body, particularly the thyroid hormone, especially when dealing with autoimmune thyroiditis, a thyroid that functions much more. This can increase my metabolism and cause excessive sweating. When I experience excessive sweating, I go to the endocrinologist for tests to get the right treatment. Wrinkles, dry lips, and more wrinkles. At the age when theoretically there shouldn't be wrinkles, so wrinkles appear sooner. You immediately think there's a hormonal imbalance, and I also monitor my estrogen levels. Do I have sufficient vitamins and minerals? And if the lips are cracked, we also think about a possible candida infection, particularly if we observe that the tongue is heavily coated and appears white, and if the corners of the lips are mostly cracked. I also do a strep test to ensure it's not an impediment. This is what we do every time, and our skin warns us that we need to see a doctor.
In about 15 minutes, we need to discuss some food solutions.
I mentioned I would share some tips for maintaining youthful, beautiful, and healthy skin. What should you do if you're worried about your skin? How should you eat? We must remember to drink enough water, many glasses of water until the urine is colorless. Next, we should take vitamins from the C, E, and D complex, which we find in olive oil, nuts, and almonds. A small portion, not excessive, just a handful, a fistful each time. The type of fish is mackerel, a fish that contains many beneficial things. Eggs should be limited to 1 yolk per day. But egg whites, mushrooms, and citrus fruits are very beneficial. Collagen production is crucial, as a significant amount of skin firmness is lost when collagen levels drop. On the other hand, collagen also deteriorates over time, especially if we are exposed to various toxic factors in these civilized cities. Ultraviolet radiation is the primary offender. You should support them with omega-3, particularly from salmon, which is excellent, but make sure to choose a non-toxic salmon, free from antibiotics, preferably wild salmon, along with some almonds and walnuts. These oily nuts are extremely beneficial for health. Oxidative stress and detoxification are crucial. If these processes don't function properly, we will face skin issues and the skin will age rapidly. What do we do about this? Numerous options exist. Ergotionine is particularly effective in preventing collagen breakdown. It's present in black beans with lesser amounts in red beans, but black beans are richest. It's also found in organ meats like chicken and pig liver. Bromelain and vitamin A, which we find in pineapple, are excellent for preventing cellulite in women. So having a daily serving of pineapple, 2 slices, is beneficial for us. Additionally, vitamin A, which we find in sweet potatoes, spinach, and broccoli, should definitely be included in meals. You can see that we can incorporate a little from each to prepare a meal that revitalizes our skin. Similarly, oxidative stress can be fought, and this detoxification part can be successfully resolved by utilizing vitamins C and E, along with foods rich in enzyme Q10. So be cautious. In fish like sardines, herring, and mackerel, which are ocean fish, ideally fresh, steamed, or grilled, served with spinach and nuts, including low glycemic index fruits like blueberries. The more vibrant these fruits are, the more beneficial they are for the skin, including currants and berries overall. And the final category? Thus, as I mentioned, we need to cleanse and detoxify the skin like any tissue, including cysteine, selenium, and glutamic acid present in yogurt, soy, and mushrooms. You must not forget water, which is the final phase of detoxifying the body. Effective detox, oxidative stress, and protection. And we preserve collagen. These are the sole methods that effectively rejuvenate the skin.
And Dr. Ovidiu Peleș, a doctor in medical science, says it well. The person who replies to your messages every time, as he genuinely cares and is quite interested. Every mark you notice on your skin or elsewhere can be treated, even if it might lead to a serious issue. If you visit the doctor quickly, he will resolve it. So God willing, let's see each other as we usually do, as friends. We can't wait to see you again next week. Life is better with you. You were wonderful.
Much
Great
love.
affection.
Much love.